My name is Elina Sarapultseva. I'm a professor of National Research Nuclear University MIFI. Today, we will describe different sources of ionizing radiation in the environment. First, let's define a few new concepts. What does it mean radiation or ionizing radiation? It is a stream of energy in the form of electromagnetic waves of subatomic particles, which is formed during the decay of radioactive nuclei. What does it mean mutagen? Mutagens in biology are factors that cause hereditary changes, mutations. They affect the genetic material of organisms, changing the structure of DNA and chromosomes, which can lead to the appearance of new signs and disruption of body function. Dose of radiation. Dose of radiation exposure can be estimated in gray and Sievert. Exposure can occur in short period of time. In the high dose, more than 1 gray for human body. It will be acute exposure. Or radiation occurs for a long time in low dose, no more than 0.05 gray. It will be chronic radiation. And two more new concepts, external and internal impact. In the case of external exposure, the source of radiation is located outside the body. Examples: cosmic rays, waste from the nuclear industry, emission caused by accidents of nuclear reactors, and internal radiation. Radioactive substance enter the body through the respiratory system, digestive tract, then eating, drinking, smoking, in rare case, through the skin. You see that radiation can be of natural origin and come from man-made source. What source of human exposure to environmental mutagen are known? You see on the slide the source of human exposure to environmental mutagens. And we will describe accidental exposure and examples of this, occupational exposure, medical exposure, and exposure from natural sources. Let's talk in details about each of them and start with accidental exposure. The explosion of atomic bombs of the Hiroshima and Nagasaki in August 1945 resulted in horrific casualties. "What have we done?" said the pilot who dropped a bomb on the Japanese city. More than 300,000 survivors received high dose of ionizing radiation. The long-term effects of radiation exposure increased cancer rates in survivors. More than 200,000 people died in the bombing in their immediate aftermath, mainly from the explosive blast, the firestorm it sparked, and from acute radiation poisoning. One more example of accidental exposure, test of atomic bomb. As of 1993, about 2,000 atmospheric and underground nuclear tests were conducted worldwide. In this case, we are talking about low and medium dose of a chronic exposure, in most cases internal. At the same time, bomb tests have polluted large areas. You see on the map of USA, for example. One more example, the accident at the Chernobyl nuclear reactor in Soviet Union that occurred at 1986 was the most serious accident ever to occur in the nuclear power industry. The reactor was destroyed in the accident, and considerable amounts of radioactive material were released to the environment. As a result of the accident, 13 nuclear industry workers died, and more than 100 people received acute radiation insurance. The territories where more than 150,000 inhabitants live were contaminated with radionuclides. Other European countries were also affected by the accident. The cesium isotope has a relatively long half-life, about 30 years. This radionuclide causes a long exposure when ingested into the human body and when exposed to external radiation as a result of its deposition on the Earth. Iodine 131 was a short radioactive half-life, 8 days, but it can be transferred to human rapidly from the air and through consumption of contaminated milk and vegetables. Iodine becomes localized in the thyroid gland, and that is why the risk of thyroid cancer significantly increased after the accident in 5 years. The accidental exposure occurred in Guyana. It's one more example of accidental exposure. Guyana is a city about 200 kilometers from the capital of Brazil. Medical equipment for radiotherapy was stolen from the hospital. A capsule with radioactive cesium was opened. Cesium was manipulated and distributed into the body by several people, including children. As a result, 249 individuals were exposed either externally or internally with a high dose of exposure. This is the example of stupidity. Do you agree? Everybody should understand that we shouldn't play with radiation. Let's say about occupational exposure. You see that average annual dose for controlled workers are much lower than those from the accidental source. They are low internal and external dose with chronic exposure. The radiation dose of nuclear power plant personnel and other employers of the nuclear industry are strictly controlled by the government standards in each country, even less in the average dose per procedure for radiologists. They are low external dose with fractionated exposure. Here you see the risk of cancer among medical X-ray workers in China before and after 1970 year. At that time, the Chinese government dramatically changed radiation safety standards, strengthening the protection of personnel, and as you can see, that related cancer risk has decreased dramatically. On the other hand, I would like to pay your attention to this slide. Look at how many people are exposed to non-radioactive sources like silica, diesel, coal, etc. In all cases, the probability of genetic effects may be high. Let's continue and talk about the medical exposure of population. X-ray examinations of the radiation diagnostics. This method is used more than 100 years. Today, there are other modern methods of radiation diagnostics. For example, computer tomography, you see on the slide. CT scanning is today considered to be the leading method for diagnosing disease of the brain, spine, lungs, and other internal organs. In fact, the procedure is absolutely comfortable, takes only a few minutes, and nothing touches you even during it. If the diagnosis made it possible to identify the disease, then we should try to cure it. Now, medicine applies a lot of high-tech technologies, high-tech methods for treatment of different diseases. First of all, cancer. Cancer is one of the most serious and unfortunately common disease in the world. Doctors can kill malignant cells using non-invasive treatment method. We can call this method radiosurgery. The source of radiation is located in some distance from the target. You can see gamma knife on the screen, which is used to treat brain tumor. And one more method, brachytherapy, usually used close radionuclide cells, which are located as close as possible to the tumor or directly at the site of the cancerous tumors. Brachytherapy is commonly used as an effective treatment for cervical, prostate, breast, skin cancer, and can also be used to treat tumors in many other body sites, as a radiation source can be precisely positioned in the tumor treatment site. Brachytherapy enables a high dose of radiation to be applied to a small area. It reduced the risk of damage of healthy tissues, organs, and structures around the tumor, thus enhancing the chance to cure and preservation of organ function. Also, CT scans are now a common medical procedure, and radiation doses are relatively low. Millions of people worldwide are exposed to radiation every year. Our medical students, whom we teach at our university how to use radiation technologies, know and understand all possible consequences for patients and know how to choose the correct procedure. I invite you to listen in more detail to our online lectures on the application of radiation technologies in modern medicine. And the last topic of my lecture today, exposure from natural source. Human exposure to ionizing radiation from natural source includes cosmic rays, terrestrial radiation, exposure to radon, for example. These figures demonstrate that the magnitude of radiation dose increase with the latitude and altitude for all passengers of aircrafts, like you, for example. This low dose, you are not to be feared with it. For the airline crew, numerous research studies have not found unambiguous negative effects of radiation. Radioactive potassium is the main source of terrestrial natural radiation. This figure demonstrates the indoor and outdoor exposure rates for the total population of several European countries. The average absorbed dose rate in air is 60 nanogray per hour. It's low dose rate. However, radiation background in different parts of the world significantly differ. You see on the screen region in China, state in India. This town in India, with population 100,000 people, is one of the most radioactive places on the planet. The cause of the high background radiation is mineral monazite in the soil surrounding the area, which contains radioactive thorium. This place is not the only one in the world with the high level of natural radiation background. The same place are located in France, in Brazil, in Russia. Here you can see an annual indoor exposure to radon in Europe. You know that radon originates in the earth, enters the house through the basement and can be accumulated in well-sealed house. The mean annual indoor exposure to radon in Europe is relatively low. However, there are some places in the world where the level of indoor exposure to radon reaches more than 4,000 millisievert. Sweden, for example, you see. But there are only a few publications on the radon-induced cancer lens. In general, the negative effects is not detected. Smoking can cause a much greater risk of lung cancer. And you can see that relative risk of death increases with the number of cigarettes per day. In developed countries, 90% of males suffer from the lung cancer, and approximately 75–80% of female lung cancer are attributed to tobacco smoking. Pay attention to this information, please. Cancer case in the UK attributable to different exposure are listed here. You see that tobacco comes first, diet on overweight comes second, third. Next, alcohol. Radiation is only in Earth's place. Well, let's summarize information about of human exposure to environmental mutagen. You see on the slide 4 different sources of radiation: number of exposed people in the world, dose of exposure, high, medium, low, and type of exposure, acute or chronic, and fractionated exposure. By the way, what does it mean, fractionated exposure? Fractional radiation therapy, we apply this type of therapy. Fractionated radiation is a method of treating malignant tumors in which the prescribed dose of radiation is divided into several sessions or fractions. This allows you to minimize side effects, plan the overall course of treatment more flexibly than with a single exposure, and assess the radiosensitivity of tumor tissue. So, you see the average radiation dose for human natural exposure is approximately 50% out of 100. Medical exposure, non-man-made exposure, 48%. Industrial, occupation, consumer exposure, around 4%. At the National Research Nuclear University MIFI, we train international students from all countries of the world to manage radiation for the benefit of humans. Welcome to our university, MIFI.